بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء وسيد المرسلين حبيب قلوبنا وطبيب نفوسنا صاحب السكينة مدفونة في المدينة المبعوث رحمة للعالمين أبو القاسم محمد اللهم صل على محمد وآل محمد وعلى أهل بيت الطيبين الطاهرين المعصومين المظلومين وبعد ولعنة دائم على أعدائهم أجمعين من الآن إلى يوم قيام الدين. Brothers and sisters, our distinguished guests from Dr. Mullah Hajj Karar al-Kufi and the ones that traveled from Sydney, a big salamu alaikum wa rahmatullahi wa barakatuh. And of course, this is a very exciting and important occasion. This is the first we've run one of these types of events where, as you all know, we've been advertising now for the last couple of days about having what we call toolbox discussions. And basically, we've come up with the idea that we're going to talk to people from the community about their role as not just in their profession, that is, but their lives as muwaleen of Ahlul Bayt, lovers of Ahlul Bayt in a society, especially in a Western society, and how they balance their lives between the religious aspect as well as that of their spiritual aspect. And for most of you that understand, alaykum salam wa rahmatullah, we'll also talk about the concepts behind a toolbox meeting, because hopefully most of you know the reason we come up, why we chose the toolbox discussion, is because at the end or at the start of every day in most manufacturing companies, or even at home, you don't think about it, but you have some type of toolbox discussion. What are you going to do for the day? What have we learned from previous days? Is there something I have to run and check up upon? And then at the end of the day, you come back and you check of what your procedure or process was, and you move forward. And each day is this similar habit. But as servants of God Almighty, we have this similar system, whether you believe it or not, depending if you're in your profession, or like we pointed out, even at home, a wife, believe it or not, she has her type of toolbox meeting. Maybe it might be to herself or get the family involved, but they have some type of meeting that she goes around and she gets the accessories for the house and so forth. I'm very lucky to be joined, at the start of the lesson, with my dear brother, Dr. Mullah Hajj Kufi, the Karar al-Kufi. But first, before he starts to introduce himself, let's introduce him with a big salawat ala Muhammad wa ali Muhammad.
بسم الله الرحمن الرحيم الحمد لله رب العالمين وأفضل الصلاة وأتم التسليم على سيدنا محمد وآله الطيبين الطاهرين
اللهم صل على محمد وآل محمد وعجل فرجنا.
السلام عليكم ورحمة الله وبركاته. Thank you very much for having me tonight. It's a great occasion. I've been looking forward to this for the last week. Obviously, my name is Mullah Karar. I've had a very interesting life. Born in Iraq originally, moved to Iran from a very young age. Grew up in the Husseiniya of Qom, and many of the reciters and the followers of Ahlul Bayt alayhim as-salam. Spent first 10 years of my life there. Went to primary school there, and then came to Australia. Went to high school here, and then ended up at university. Initially, I did a little bit of part of a science degree in Campbelltown, so closer to you guys than Sydney. And I spent the next 5 years studying dentistry in Queensland, and I finished my dental degree, and then worked as a dentist for a while. And then I thought I wasn't crazy enough, so I should do a little bit more. And I looked into the option of doing medicine, so I ended up getting into medicine as well, and I finished my medical training, and I call myself the baby of COVID, because we had to train through COVID, and we saw some terrible things happened, but alhamdulillah, all of that is behind us. And now currently I'm specializing in general practice. So I am in the middle of specialty training for GP medicine, and I also maintain my dental practice on the side as well.
Ahsan, ahsan. So as the mullah, mashallah, as you said, first of all, he pointed out that he's done all this study, but I would like to ask him what motivated you first to actually, like you said, you went to, first of all, to dentistry, and then you moved later on to medicine. Was it anyone in your family, was it inspiration, or what was it?
Yeah, look, I think I've always, many of my friends know that even from my young days, I always wanted to be a doctor. That was something that, you know, it's a bit of a cliche, starts off, you know, every parent wants their kid to be a doctor. But there's a hint of truth to that, because everyone wants to see their kids succeed, and my dad was very supportive, my family was very supportive. And, you know, initially a lot of the opportunities came by. I tried and it didn't work out. You know, I tried everything I could to try to do different things to get myself there, but I had lots of motivation from family members, even though I was the first family member to go to university, so it was a big deal going to university on its own, regardless of which course I was going to do, so I was supported. But I think the biggest motivation for me was growing up in war-torn Iraq and then having to move to Iran, which was, you know, at the time, it's quite difficult. It treated people differently who were not from their own group, and the Iraqi diaspora at the time who was moving from Iraq to Iran were in a very difficult place. And I used to see some things in terms of people accessing medical care, and when I came to Australia, my eyes got opened onto the medical system here. And I found that was probably one of the biggest motivators to see if I had the opportunity, I was going to pursue it. And it worked out eventually. But
one very important point that Dr. Karar just pointed out, that he chose it. He chose the career because he loved it. And he said also that most parents, or most Middle Eastern parents, we find that they want you to become either doctors or engineers, you know, in his professions. But it doesn't mean that, you know, for instance, you know, unlike Dr. Mullah Karar, who also serves Ahl al-Bayt, as you know, from many of the centers, there's a difference between someone who's a doctor and follows that profession and holds on to his faith, and can, as he's been proven, hold on to his faith and both be successful in the dunya as well as that of the akhirah. But I guarantee, if I ask the mullah now, you know, as much as his passion is in his worldly life, but more is probably his passion for the services of Ahlul Bayt is much greater. It's probably they're his role models and inspiration for him to be like a role model in his profession, as well as the religious aspect. And it's very important to go back to talk about the profession, to say that he will, which we'll talk about shortly now, the balance between something that's you know, the everyday life and holding on to the religious aspect. Basically, even for the person wanting to become a cleaner, I'm just saying as a profession, a person who wants to become a cleaner and holds on to his faith and is a muttaqi, is much, much better in the eyes of Allah subhanahu wa ta'ala, in the whole of, you know, our religion, than a doctor. I'm talking about Mullah Karar or Dr. Karar. Then a doctor that follows a profession but only is focused on the worldly aspects. That's it. All he sees is the mal. There's a big difference here. We're not telling you can't be successful. You know, a zuhud doesn't mean that you can't be successful. A zuhud basically means to own something, but not that thing own you. Not thing that you always chasing. So we got plenty of people that were successful in their lives. You know, Prophet Sulaiman, you know, very successful, you know. So the factor is that we are trying to encourage you and to show you that it can be done. It can be done, and you'll see over the next episodes, whenever we do, that people like Dr. Mullah Haj Karar shows that the inspiration that he does this is because of his faith, because of his love for Ahlul Bayt. So, going back to what we talked about in terms of medicine, we know that, for instance, when we talk about doctors, the first thing that comes to doctors is that we're only going to see a doctor when he's sick. Right? And so when you talk about sickness, is sickness something that, we'll talk about the religion part after, but when you see sickness, is that sometimes a good thing? Or do you see it like as a warning? Or can it also be a good thing as well as a bad thing?
Look, I get many patients that ask me the exact same question. And they actually use themselves as an example of, coming to the doctor only when they're unwell. And I always answer them with the same answer. I say, do you ever only take your car when it's not working?
Yes, it's a good one.
You need to maintain your car. Your body is a well-oiled machine up until you reach 50. And then things that, no, I'm joking. But it's a well-oiled machine, and you need to maintain it. And illness isn't always bad. You'll get illnesses that are warning signs. A common example is pain. When you get pain, it can mean many, many different things, and it's the body's way of telling you to get help. So illness isn't always a bad thing. When the body gets ill, it's one way for it to try to fix itself, or one way for it to get you to get some help. And one way for you to self-reflect and think about, have you, done something or have been up to something that maybe you need to reflect on. And we have many stories of the prophets and other members of the Ahlul Bayt who have needed some time to reflect after a major tragedy or a major event that has, or a major illness.
So, like you pointed out, in terms of the religious aspect, it's very important that sometimes we see, or most people see sickness as something bad, as we're trying to point out now. But according to a hadith, like we have a hadith by Amir al-Mu'mineen alayhi salam, he says, al-bala lil-zalim adab. Like it's someone who's, that is an oppressor. It's like a discipline, walil-mu'min imtihan. It's to test you, to see your faith. And then, of course, the hadith goes on, and says, وَلَلْأَنْبِيَاء daraja, lifts them up to a different level. And the most last one, وَلِلْأَوْلِيَاء karama. It brings them the honor. So sometimes, and we have many narrations that a person gets sick, is a wake-up call, is a test, but it's sometimes a result of someone's sin. Like a sin, and for God to say, hold on a sec, that bit of feeling that you got, God forbid, that bit of takabbur, or that you come down to the point now where you're sitting there and subhanAllah, in that state, everyone becomes a mu'min.
And they pray very well.
I'm going to start doing salat al-layl, I'm going to start doing the taqibat, all these other things comes in.
But even that, Allah subhanahu wa ta'ala wants you to do that. Right?
Yeah.
It's giving you the little pinch, tells you get on with life and see what's more important. And you talked about bala, bala doesn't always come down in sickness. It comes out in many different things, Either it's grief or loss or mental illness or even like natural disasters, rising interest rates. That's a bala,
It's so true.
If you can't make ends meet, you're going to have to sell your house prematurely, right? And there's lots of people from overseas who would pounce on an opportunity.
Exactly.
Like that. But that's an opportunity for us to kind of self-reflect. And we have traditions from the Ahlul Bayt alayhim salam that say that Allah subhanahu wa ta'ala places the treatment of one's illness, maybe in the hands of someone. So if you go to a doctor, one of the things from the riwayat of Ahlul Bayt says, Dawu mardakum bis sadaqah. Before you go and get treated, pay a little sadaqah and then go to the doctor. Allah subhanahu wa ta'ala will provide the opportunity for you to get well. That doesn't mean that you should sit at home and wait for Allah subhanahu wa ta'ala to make you better. So you should always seek help.
That's subhanAllah. On that point there about seeking help, first of all, as the Quran points out, وَإِذَا مَرِضْ فَهُوَ يَشْفِي. So the Quran has pointed out that if you are sick, then it's God that does the healing. Yes, it can come through different means, but God has his soldiers, as the Quran says, وَمَا يَعْلَمْ جُنُودَ رَبَّكَ إِلَّا هُ. That no one knows the soldiers of God except God. The doctors are soldiers of God. Every person has some type of role in being a soldier of God. Yes, we have to, like the doctor said, we have to go and seek professional help at times, because even Prophet Musa, ala nabiyina wa ali alayhi salam, the famous story where he actually got sick and he was just using dua. And dua is very good. Dua, as we said, is the salah, the weapon of the mu'min. But, he did it. He hears a knock on the door the first day. It's one of the doctors, the physicians from Bani Israel. He says, no, I'll put my trust in God. Second day, third day. Then Musa kind of like, he's not complaining, but he says, oh God, I've been doing dua for you for several days. Then he sends an angel. He tells Musa, I sent you already the first day, the second day, the third day. He said, these doctors, who creates them? It's you, oh God. Who gives them the ability to even make the medicine? It's you, oh God. So why didn't you take it? So this is a way that God was showing Musa, yes, you're Kalim Allah, you talk to me. But at the same time, there are other ways that God accepts the dua of the believers. So when we talk about now, we always hear about medicines and, about the health system. That's what you come across in terms of the everyday life, like you pointed, servicing the car, for instance. So we service the car, and cars that are serviced are much more likely to run better. And what do we need, from your medical point of view, and we'll relate some back to the Ahlul Bayt, what is the stuff that you have found in your studies that are similar in the medical treatment that we need as servants of Allah subhanahu wa ta'ala?
Look, I think there's a few things that come to mind. A few important things are, there's a concept in medicine, we call it the bio, psychosocial, spiritual way of treating a patient. So bio suggests that it's a biological method, so using tablets, medicines, etc. Psycho meaning using mental and psychotherapy and talking to people and understanding things. Social is about making sure that you have the appropriate support and the family and the community members and access to services, etc. And then spiritual being that, do you believe in a faith? Do you have a system for you to go back to when you're unwell? And that's, we call it the holistic way of treating a patient, or holistic medicine. And that's really important because it comes down to trying to identify what illness is. If you want a definition of what illness is, it's an imbalance between those four things: the biological, the psychological, the social, and the spiritual. And if we can understand that, that means that not everything can be fixed with medicine. And that's something that we absolutely believe in the health profession. And the thing that really makes there's been quite a lot of evidence for in the recent times, in the last 50 to 60 years, is about the types of foods that we eat. So all of what we put in our body reflects on us, whether it's our healing or our behavior or even our kids. We can talk about the effects of sugar on kids and things like that later, but the gist of things are that you are what you eat.
Subhanallah.
There's a lot of evidence for that. There's a lot of traditions from the Ahlul Bayt that support that. And if I could make one point, and that is, the point of today isn't for us to prove the traditions of the Ahlul Bayt alayhim salam. The traditions of Ahlul Bayt are true regardless of what we think.
Exactly.
And regardless of how much evidence we have, and regardless of how many studies there are, they are true. But it's just a way for us to try to make the meaning of these things a little bit more close to us. And with the current advent of what we call evidence-based medicine, when you go around and ask about, what's your proof for doing this? Yeah. What's your proof? If we have extra proof to provide, perfect, we can do that. If we don't, we as a community, we as the followers of Ahlul Bayt, can very much use the traditions of Ahlul Bayt and use them as our guide, regardless of what we do. got nothing to do with your profession. It's your day-to-day life.
And subhanAllah, what you just said there, you are what you eat. So, and when we
There's a deeper medical meaning to that, but we can get to that after we've discussed it.
and even a hadith, there's a hadith by Zurara, Imam Muhammad al-Baqir alayhi salam, where he says that all the sins are bad. وَأَشَدُّهَا, and the worst of it, or the most severe of it, is what's made up from the lahm, the flesh, and the blood. And of course, flesh and blood is made up of basically what you eat.
Of course.
And then so the Imam says, أَمَّا مَحْرُومًا أَوَّ أَمَّا مُعَذَّبًا. So either it's haram or it's going to be punished. So this is to show you again that as servants, or as lovers of Ahlul Bayt, I would like to say that when you have that, and we have a hadith as well, that the drying of the tears, it's okay. One of the hadith says it's for sinning that it dries up, and the qaswat al-qalb is also drying up because of excessive sin, but also is what you eat in your body. And when we say halal, people automatically think it's just the biha, which is it's not it's that food. How was it consumed, or how was it purchased? From what means? What was the money halal? And so forth. All this, even though it goes through a cycle, the food might be halal. It might be you might bought it from a halal shop, but if you bought it with means of haram, then you're actually affecting the spirituality. Because I always say to people, you don't go out, you don't want to get food poisoning. Who wants to get food poisoning? And your body reacts in a way.
Believe me, you don't want the diarrhea with food poisoning. It's no good.
Yeah, I think I don't want to go into much details about that, but I've had once I had food poisoning from milk. My God, it was like knives cutting the inside of me. But I'm saying that's your body.
But the interesting thing is that those are the physical manifestations of something like that. But we have an equal amount of spiritual manifestations of eating haram, or eating something that is, figuratively poisoned.
And on that point of eating now, so, but they always tell us, when I grew up, they told me you had to eat like from the 5 groups of food? Yeah. You have to do this to be healthy, So, and then basically as you grow older, you start eating, basically following your desires and your appetite. But your medical perspective of it, of what we eat, and according to like the hadith of Ahlul Bayt alayhim salam, when they say that, for instance, that you eat only when you're tashtahi, when you crave it, and you actually get off the table when you're still craving for food. So what is that if there's anything that that is similar in the relationship between what Ahlul Bayt told us to eat, like whether we eat our this type of groups or this type of food, and whether the intervals are like they teach us here in Australia, that you have to have breakfast, lunch, and tea.
I think the current, I'm going to try to be a little bit more from the medical side of things to try to explain to you how we think when you come to us as a doctor. So one of the things that we look at is what we call a balanced diet, to try to incorporate multiple things from different groups so that you become healthy. And a great example of this is, lots of our friends here are very well ripped up, and when they end up going in the gym, they very much actually study up exactly the components they need to eat and drink, and how many calories they need to eat, and how much they need to keep off, what proteins they need, and what carbs they need, and what to avoid when they're bulking or shredding. These are all terms that only those who are bulking or shredding would know about.
You should have seen me when I was shredding up.
I'm sure there's photos. And we want to keep this interactive, actually, because if you have questions, we'd encourage you to ask. But the idea of the balanced diet, in fact, at the moment, the most evidence suggests that the best diet to eat is what we call the Mediterranean diet. There's a lot of evidence for that.
Is that the
Mediterranean
Lebanese one?
diet.
Is it just Lebanese?
Well, there's a little bit of Lebanese, a little bit of Greek, a little bit of Islamic traditional, lots of Islamic traditional foods, which we'll talk about, are actually, there's a lot of evidence for. And the idea of a Mediterranean diet is, it's a diet that reduces your risk of heart disease. And heart disease is the #1 killer in Australia.
Exactly. Yeah.
Okay, so everyone at some point will get clogged up arteries, and unfortunately may or may not get a heart attack or a stroke at some stage in their life. So to avoid that, or to reduce the risk of that, this diet is the most studied, at least from a medical side. And the Mediterranean diet is the idea of using nuts, for example, olive oils, not much saturated fats, so lots of unsaturated fats like fish and meat, such as white meat. But with the fish, we can talk about some things later, about some of the things we should be careful of when we're eating fish. And then trying to incorporate the groups of food, so fruits, vegetables, meats, breads, and things like that. The way I like to explain it to the kids is that try to have as much variety of color in your diet. So really dark green, really dark red, really, fruity, different colored things. And that will explain to you in general terms the different groups of foods that you should eat. And obviously to try to stay away from refined anything. If there is refined in front of a food, you should stay away from it.
So like when you say refined, they're your dry meats?
Yeah, so dry meats, processed meats, refined sugars of any sort. And we should try to utilize things like natural sugars. So sugars that are present in fruits, for example, or honey, or other things that are available quite naturally. But anything refined, we know for a fact, processed meats and aged meats, based on the World Health Organization, are one of the top 10 items that can cause cancer.
SubhanAllah, just on that point there, Sallu ala Muhammad wa alihi salam Sheikh. Just on that point, as the doctor pointed out, raw meats, SubhanAllah, we have ahadith Ahl al-Bayt that were asked about what is the worst type of foods that they would not consume, and they said dry meats. So that's actually a narration from Ahl al-Bayt. So it said you find there's a lot of the medical, as we said, we're not here to prove, because Ahl al-Bayt's words, that's it, the divine, and there's something spiritual about them. Only maybe later on we'll find out these aspects, but
there's many theories, and there were many things that we didn't know about that have only recently come to light, that were the traditions of the Prophet ﷺ, and some people actually made fun of at some stage, but then had to go back and they were proven wrong. One of them was the idea of urinating while standing up. So we have many traditions from the Ahlul Bayt alayhim salam that urinating while standing up is not good, right? And we should urinate while we sit down. Now, initially, there was quite a lot of talk about this being not true, and it's equally as normal. But there's been a little bit of movement on the type of evidence that's available, and that describes a few points of issues that can happen when you stand up and urinate. So one of them is
just quickly on that. Just explain to them that it is so. About how you pointed how bad it is, but like in terms of the Islamic fiqh, they would call it makruh, something that's disliked, and like the doctor would say.
Yeah, so from a jurisprudence point of view, so the way you follow your marja' of taqleed, they will explain to you all the rules about what you shouldn't do, what you can and can't do, what's makruh and what's halal and what's mustahab and what's to avoid. And one of the things to avoid is to urinate while standing. The other one that the Ahlul Bayt say not to do is to urinate while you're in the shower. And these are two things that, there's a riwayah from the Imam al-Sadiq alayhi salam that says not to urinate while you're in the shower. And I tried to look up some bits of evidence for you to try to make it a bit exciting. So the first point is that the kidneys, when you stand up, get a little bit more harder, and they don't release enough urine. And the second thing is that the bladder, which is a small organ where the kidneys drain all of the urine into, the bladder gets tense when you stand up, and it doesn't actually completely empty the urine. And they found that those that had prostate issues, they certainly had trouble doing a full wee while they were standing up. And the recommendation was to do it while sitting down. So this is direct evidence from studies. And we know from the riwayat of the Ahlul Bayt. There was another talk about the way the urine comes down into the bladder. It's like it gets swirled within the bladder. And as you stand up and release the urine, that swirling motion kind of comes to an end and then exits through. And that is the point where it gets tight when you're standing up. And when you sit down, it gets relaxed. So there's a few things that talk about that. And the second point is when you stand up and urinate in the shower, there's been a link found between doing that and having problems with, we call it dribbling, and that is that if you
nothing to do with basketball.
Nothing to do with basketball. This is abnormal dribbling. And that is that if you go to the bathroom, for example, and you start urinating without having power over yourself, right? It just kind of comes out with no power. You have no control over it. And they found that the reason for that was that your body associated the process of urinating with the sound of water.
SubhanAllah.
And so that if you had a shower, you start dribbling, which is really weird. And it shouldn't happen. So. And this is why the Ahlul Bayt don't tell us things because they just want to. They tell us because it's good for us. So the importance of that is to try to, if you know, I can see how easy it would be for someone to do it in the shower because it's easier. But take a break, do it in the bathroom, and come back. It's as easy as that.
Since you're on the topic of that, because most of us work, of course, outside and that. And it's a bit embarrassing sometimes when people have walked into the toilets. You know, it's happened to me at work as well. Like, you know,
I'm sure it has.
You walk in a toilet and then coming out holding a bottle, and it's like, you know, and then people looking at it, and the first thing that comes to their mind is like, what's he doing? Is he drinking in the toilet? It's actually very hard to explain to them. Like, you know, basically we have to purify ourselves. You know, so. And, you know, there is always to show you that the means that when it comes to urine, since we talked about the fuqah, it's very important that there's nothing to be ashamed of. Wherever you are, there are means of tahara is very important. So, you know, you can always pre-plan ahead, you know, even if it means you have to stop at that petrol station and buy a bottle, you buy it.
Or the solution is this.
Or
the frozen drinks.
It's a good idea.
Right? You cut off the top and it becomes a ready-made bottle. No one needs to know about it. That's the most important.
It's a good one.
Yeah, and then it will go in it's waterproof. And you can use it in the time of need. And it's 250 mils of water, which is not bad.
It's got plenty because even though it's going to be white, my Khalil, you only need, you know.
But sometimes the bathrooms are small enough for you to refill.
Of course.
During the process, and it goes right back in your wallet. So there are many ways of doing it, you know, and it's an important way of trying. Obviously, you need it for tahara. You're going to be praying, and that's another point we can discuss. Is, you know, your workplace arrangement for when you're praying. That's really important. You know, time of prayer is really important. And you should have arrangements at work. You should talk to your boss, or if you're in a workplace, or it's hard sometimes, and you can't do much about it. But if you can, please do.
Thank you, Hassan. Just quickly, since we talked about foods and narrations, we have, you know, when I was young, and even when I was young.
You're still young.
So you know, we're always told about an apple a day keeps the doctor away.
It's a beautiful saying.
Yeah. So logically, I used to think that, you know, it was like my apple was like kryptonite. For Superman, like if I put it in front of a doctor, it would just keep him away. Like, you know, not knowing.
And you're not entirely wrong.
Yeah.
There's an element of that too.
So, and I actually used to go and pick the green apple because kryptonite looked green. I thought, you know, but then of course I found when I used to go there and the doctor would give me a needle and I'd be screaming, it didn't work. But we know that according to our narration, Ahlul Bayt, that they have so many tufah, about the apple is unbelievable. Like, you can imagine thousands of years ago, Ahlul Bayt are telling us that to eat apples are on an empty stomach. And we found like only how many years on, or thousands of years on, that it does, apples give you that energy for. Is there any scientific factor or evidence why it has to be on an empty stomach?
Apples are a very interesting fruit. In fact, they're studied very, very widely in the community, in the medical field as well. And that saying didn't just come from the abyss. There was certainly a reason why those people that adhere to eating apples and other fruits of a similar kind, they spent less time needing medical attention. And it comes down, now to answer your question directly, I don't know exactly why when you eat an apple first thing in the morning and why that's important and how that has an effect. The Ahlul Bayt have made that very clear about it. I'm not sure, but I know that fruits are classified into different groups, and some fruits provide you with energy quickly, and some fruits provide you with energy over time. And the evidence suggests that apples are equivalent to caffeine in the way they provide you with energy, right? So I think the number they've said is 1 apple is equivalent to about 2 cups of coffee, And it doesn't happen straight away. When you have a cup of coffee, you feel really high for about half an hour, and then it just dissipates, and that's why you have to have another and another and another. But the nice thing about apples is because of how much nutrition is in them and how hard they are, it actually takes a while for them to get digested in the body. And potentially, that could be an explanation as to why if you eat them first thing in the morning, that they will take a while to digest, and you will feel full for longer, and you will have enough energy to go through your day. And it's a fruit that is probably not used a lot of these days, especially for our young generations. Our lunch boxes should be filled with fruits and some vegetables. I know some of them are boring, but some vegetables, rather than other things, refined sugars and that sort.
SubhanAllah, even to that point, it reminds me of a hadith of Imam Muhammad al-Baqir alayhi salam. He says, like the hadith says that one of the etiquettes of eating an apple, the Imam said he would smell the apple first. Smell it. And he says, if you smell it, he says, even by smelling it, it gets rid of any samum or toxins in your body, just by smelling it. So subhanAllah, the aspects that Ahlul Bayt had on the tufah, and another narration says that it also gives you a nice breath and gets rid of at least 70 types of illnesses in the body. So that's one part, the apple, which is very important.
I might just, before you move on to another point, there's 2 things I wanted to make. Number one is regarding the fixing the breath. Now, bad breath is probably a very, very common problem that we encounter in the community, and it's one that is very, very embarrassing to talk to other people about. And one of the most common causes for that, this is my dental thing coming in now, is the lack of brushing. And, we can do a little session about dental stuff another time.
Yep.
But the apples have been found to do manual toothbrushing for you. Because of how hard they are, when you chew on them, they remove all the bacteria and they stimulate the gums. And they remove this white layer on your tongue when you first wake up in the morning, and they clear that out. And that's the number 1 contributor to bad breath. The second point is about the smell. Now, when I was doing some pediatric training in the hospital, one of the things that I noticed one of our senior doctors was doing was encouraging the parents to get their newborns to smell fruit, right? I'm like, this guy's crazy. What is he on about? This newborn coming in, and you put an orange in their nose. What are you doing? And then I asked him, and he said, well, we have some proof to suggest that stimulating a newborn or a child's senses by utilizing some fragrant fruits such as apples and oranges. In fact, with the oranges, he used to ask them to peel the orange and let that little flavoursome thing to come out. Or when you do it with a mandarin, skin your friend in someone's eye.
Something in the eye, yeah.
A common thing lots of us used to do back in the day when we were young.
But the apple was very important. Like I said, I know some of the narrations talk about, subhanAllah, that the essence of things like Fatima al-Zahra, salawatullah salam
Salamullahi
alayha.
alayha. And that's a big secret. The secret
The
of
secret
the Sayyid
of
al-Zahra,
yeah,
salamullahi alayha.
some of the narration says that it was like an apple that the Prophet consumed. And then he said that every time he yearned to smell the fruit of that heaven, he would go and smell Fatima al-Zahra.
Allahumma salli ala Muhammad. One of the secrets of the Sayyid al-Zahra, salamullahi
That's
alayha.
one of the many.
Tufahatul Jannah.
Subhanallah.
Salamullahi
Sayyidina
alayhi.
sallallahu alayhi.
An unbelievable fruit. One of the fruits, actually, the other day, they did a study at Woolworths. And they found out that the oldest fruit they had on their shelf was the apple, because it was the longest lasting. And guess how long it was on the shelf for? What do you think?
Guess.
9 months it was on the shelf, and it was being sold for the same price as it was on day one.
Subhanallah.
$6,
Holds its
$7 a
value.
kilo. And also because they put a small layer of wax around the skin of it. But it remains quite a useful fruit from a business point of view, for those of you who have fruit shops. I don't know.
So a lot of things, like, some people reckon, or like, I know the Christians reckon, or have this idea that it was Adam that went to the apple tree as well. Like, we don't actually know what type of tree it was. Another thing is to do with apples, so Isaac Newton with the gravity on his, an apple falling on the head.
Yeah. And the saying that the apple doesn't fall
Far from the tree as well. Yeah. Have you ever played the that game?
Clash of Clans? No.
No, or where they used to, I don't know, they used to put because apples float in water.
Yes.
And then I remember when they used to go to the school fair, there was like, you'd win a prize. They had this like big bucket, and had the apples in there, and you had to grab with your teeth, and because it was bouncing, then I remember everyone was having a go, and then all of a sudden this giant came. Basically he just put his whole, he just grabbed it. It was like a 2-second job. And then
it sounds like a thing you would do do you remember the show Minute to Win It? When you used to do those crazy things in 1 minute? That sounds like something you would do.
What about going back to apples? About the fact that, can you kind of get away with it if you use like a toffee apple?
Look, I think there's some traditions from the Ahlul Bayt to suggest that sour apple is something you should stay away from.
It's ahsan, yeah.
And for me, based on my reading of whatever I could find, I couldn't find enough to suggest why sour apples were no good for you.
Doctor, it's enough it's enough that they call them granny apples.
Yes.
Like honestly, like granny apples.
Granny Smith.
Yeah, Granny Smith.
Granny Smith.
Something like, I'm not having anyone go at anyone that's old. Yeah.
Yurath an-Nisyan, yeah. We know what it does. Yurath an-Nisyan.
So we have,
and it may lead to forgetfulness, but as to exactly how it happens, I need to do a bit more reading.
So what Samah the Sheikh said, that we do have narrations that sour apples have an effect on your memory. On that fact, on the memory now.
But I've heard that Fool Mdammas does the same thing.
Oh, man. And the kuzbara as well. Kuzbara.
Coriander.
Coriander. Coriander. Hadith is eating, because I know.
Whoever loves their Mexican food.
Yeah. Especially
can
like
close their ears now.
Especially like Lebanese people, they. Yeah.
Of course, if you eat too much of it, the Sheikh gave us a solution.
But since we brought that about memory, the hadith of Ahlul Bayt about honey, because honey, the Holy Prophet sallallahu alaihi and Ahlul Bayt alayhim salam had said the opposite. Honey actually increases your memory, and also once again gets rid of many diseases. Eating honey in the morning with habbat al-barakah, black seed, also increases your memory. Having raisins, the hadith says to have 21 raisins in the morning, also increases your memory. So all these narrations, Ahlul Bayt, also there is, like I say, a counter medicine in case someone does eat it. So
speaking of honey is probably a very underutilized resource in Australia. And we have quite a lot of different types of honey. But the most important point about honey is that if you leave honey outside for, let's say, a month, what do you think happens to it? Well, it might crystallize, and we can talk about why that happens, but what else? You leave it open for a month. It may dry up, but do you ever get any growth on it? Nothing ever grows on it. It has very, very powerful antibacterial effect and antifungal effect. Now, if you put a piece of bread out in the open for 1 day, what happens? See, I was waiting for someone to say mold, but you have never remembered ever seeing mold on honey ever in your life. Because that never happens. Honey has powerful antibacterial properties, and it's a powerful antibiotic when you're unwell. That's why all these lozenges, you know, the strepsils that you buy, what do they have as an active ingredient?
Honey.
Surprise.
Subhanallah. So, but
get into the manuka, honey.
Get to the manuka. But since you brought that up about honey, the actual bee life itself is a miracle. Bees themselves, and I've mentioned it, I think, before in another speech, bees will not let a single bee that has eaten from intoxicants, and usually when it gets from a toxicant or fermented fruit, it gets actually drunk. So when it comes to the beehive, it has to do what they call a waggle dance. It dances in front of them, and they can tell whether it's drunk or not. And then they can let them in. But to show you that, subhanAllah, to show that they want to keep the hive clean. And that reminds me of a hadith that it's related to food. Imam Ja'far as-Sadiq alayhi salam says, subhanAllah, he goes, I'm ajibt, I'm like kind of shocked to see that a person will stay away from certain types of food for the fear that it's going to bring diseases, but won't stay away from certain sin that are going to also affect him as well. And once again, the good thing about it, the Imam's using food here, using food as an example. And we know, going back to the point that we said about food, when Imam Hussein alayhi salam stood there, and you know, he's trying to talk to him, and then in the end he says that their stomachs were full of haram.
Full of haram.
Full of haram.
And he repeated that in multiple of his sermons that he gave on the day of Ashura, and he was trying to, and during those sermons, he used to describe al-shajara al-khabitha wa al-shajara al-tayyiba.
Again,
and he describes this in both the figurative meaning and the literal meaning, that a lot of these people that were from the shajara al-tayyiba were actually eating from halal sources. And not just halal slaughter, which we talked about.
Yep.
It's halal means of gaining and the halal way of approaching.
Just since you brought that up about fruit again, according to the narration of Ahlul Bayt have said that they would not eat fruit that was out of season. Like subhanAllah, when you look at the fruit now that God creates, subhanahu wa ta'ala, it's unbelievable. So it's not by coincidence. Like, friends, look at the fruits that are made in winter. What are they?
Can someone tell us?
Fruits
of winter.
Fruits of winter. Mandarin,
so
oranges,
all the citrus.
Citrus. Yeah. What do they contain? But what does citrus contain? No, what vitamin? Vitamin C.
Yeah.
Now,
big in vitamin C.
Big in vitamin. And you look at, for instance, like now we're into the summer, you find that, for instance, the fruits are summery fruits.
Yeah.
One of the biggest ones.
The boys here were talking about some summer fruits. I heard mango.
Yeah.
Anything else? Strawberries, yeah.
Watermelon.
Watermelon, very, very good fruit. And beautiful fruit.
And in fact, we have a hadith about watermelon from the Ahlul Bayt alayhim salam, about how they would actually like this. But
and even if you try to eat watermelon when it's cold, it just doesn't taste right.
Yeah.
Have you ever had it in winter? It just, like, you don't even feel like having it. And the body actually rejects certain fruits at different times of the year based on whether they are warm-based fruits or whether they are cold-based fruits. And that's a very complex discussion we can have another time. But it's got to do with your natural body accepting warm or cold foods at different types of the day. So I'll give you a very simple example. Watermelon is counted as a cold food, while rock melon is a warm food.
Yeah.
Okay? So one of the things that you feel that when you eat rock melon is a burning sensation at the back of your throat. And that suggests it's a warm fruit. Now, when can you have one or the other? It's got to do with the ambient temperature. You know, when it's cold, you have the warm fruit. When it's warm, you have the cold fruit. So, but if you start mixing things together, you're going to have problems. Because out-of-season fruits, from a medical point of view, they are very poor in nutrition. They don't have the nutritional value as, the same watermelon that was grown in summer conditions is completely different to a watermelon that was grown in winter conditions. Okay? And tomatoes, these days we have 24-hour producing tomato greenhouses.
Just quickly, the tomato, is it a fruit or a vegetable?
Can you prove to us why?
Yes, of course, it's a fruit. Then,
so the definition is that all fruits must have their seeds inside of them. So eggplants technically are fruits, while strawberries are technically not fruits because their seeds are on the outside. But so to the point of the nutritional value, you don't get the same nutritional value in out-of-season fruits, and there is very, very strong traditions to suggest that you should stay away from fruits that are not in season. And the second thing is that we see all these natural disasters, all these floods, bushfires and things, and we have, quite a lot of evidence to suggest that it's because of global warming, right? And all of this, all of this carbon that we release into the atmosphere, all these trucks that we drive hundreds of thousands of kilometers, all these planes that go to get us our mail from one point to another, they're also the same transport that transports all these stone fruits for you to enjoy in winter, for example, after they get them from the United States, or you get pomegranates during the time when they're not supposed to be here, and you see them for $10 each, and you'll be like, oh, I should have this.
yeah.
You know what I mean?
Yeah.
And we are actually contributing to the environmental problems, which Allah subhanahu wa ta'ala and the Ahlul Bayt have described to us many times, that the israf is something you should stay away from.
Exactly.
If you're, the famous tradition by the Imam that says if you're on a river and you want to make wudu, use the water that you only need for the wudu. Don't make israf. And it's free-flowing water. So when you're overusing and you're overindulging, you have to be careful as to what waste are you producing, what environmental effect are you having on the planet. And at the end of the day, if you're living in a farm, you could be affected by the next bushfire. You don't know. You could be affected if you're in a flood-prone area. You could get a flood that could take half your house away. So I think the point of this is all of us should try to pick up points and understand them outside of from just a religious point of view or just a work point of view. It's the whole way of looking at our life. How can we make ourselves improve ourselves more based on the teachings of the Ahlul Bayt?
Since you brought about the point about the environment, first of all, one of the worst things I used to hate going to the doctor is when he used to stick that paddle-pop stick. Yeah, this thing, but it's similar. But what's first of all, the paddle-pop stick comes from a tree.
True.
Yeah. So I'm thinking now, so just, an opinion.
It also comes after you've had an ice cream.
Yeah, it could be. That's a good. But how about we get to the point of view where, you cut up some cucumber, put it in the guy's mouth or something.
It's true. They could aspirate on it.
Cucumber, celery, something different. Then give it to the patient. Say, look, you eat it.
It's a very good alternative. And I have to say that I've always thought about in the medical side. Now, forget about in the clinic. When you go to hospital, everything is single use.
Yeah.
Everything. Sayyid Jawad would know very well. He's a single use producer of half the planet. But when you're doing surgery, you're putting the drapes on, you're doing everything is single use. And every surgery that they do, you get maybe kilos and kilos of rubbish that gets produced. And that's something that medicine, I think, is a little bit behind. We should look after the environment. Yes, those paddle pop sticks come from trees, and they do have to cut trees to get them. And that's something that I've thought about a lot. So these days I've been trying to use the light and to get them to say which I think you have a problem with. But anyway.
And that's another thing as well. Can we the language barrier, because it just sounds like it hasn't changed over the years. It's just the same But since we're probably much running out of time, just quickly, what we're going to do now, we're going to get the doctor to pick up some of his tools that he uses.
I think
first of
we'll
all,
just use this one. I think this has a lot of meaning.
First of all, does anyone know what this is called?
Yeah.
The
What is
actual
this called?
physical word. What is it? Is it?
Stethoscope. That's very good.
It's pretty close.
Yeah,
I
stethoscope.
thought he said stethoscope.
No. You don't step on this.
I know.
So a stethoscope is a very interesting. I think this is the only tool we'll talk about because this is really important.
Yeah.
A stethoscope is a tool that we use to listen to things, and you can listen to a lot of things. And if you've watched the Italian Job, one of the things they do. Has anyone watched Italian Job here? Yeah. No one else? Gosh.
Are you serious?
Boring.
What kind?
So one of the ways is they listen to the noise as they're opening up the safe.
The safe.
And they use the stethoscope. And it's a great tool. We listen to people's hearts. We listen to people's lungs. We listen to people's bowel movements before they come out, of course. And the heart, probably one of the most biggest advances in medicine that we can hear in all of the locations of the heart, and we can diagnose some very, very faint sounds, tiny little changes in the normal sound, we can identify with this. But the point isn't that we should just use the tool to listen to the heart. We talked earlier about, what are the things that make the heart, rock hard. The Ahlul Bayt talk about qaswat al-qalb, people that don't cry on the musibah of Ahlul Bayt alayhim salam. I think one of the companions asked the Imam and said, "Why don't I cry?" He told him, "It's because your heart qasi. Either you don't eat the halal way, or you don't produce." And the ayah of the Quran that says, "Ala bi dhikrillah tatma'innul qulub." So we are not mentioning the name of Allah enough times. And so lots of people look at the physical heart. We should try to explore and review and self-reflect. And the other tradition that says the small sin is like a tiny black dot on a white background in the heart.
In the heart,
and the more that you sin, these small dots get bigger and bigger and bigger. It becomes, your whole heart becomes black.
And subhanAllah, even on that, the Quran talks about that. Khatam Allah ala qulubihim. Like it actually covers the heart. Wa ala sam'ihim wa ala absarihim ghishawa. Like a cover. And because, so we talk about the relationship here between the physical and the spiritual heart. Even many verses about for instance, that guy says, amtahala qulubuhum lit-taqwa. Like he tests their heart to see whether they have taqwa. That in Surah Al-Ahzab, it talks about that God does not create a person that's got two hearts in him. Because the heart should be only for one.
True. And your loyalties should lie in the one
Qul inna
place.
salati wa nusuki wa mahyaya wa mamati lillahi rabbil alamin. Everything is for you. If your qalb, as they say, qalb is-salim,
إلا من أتى
Allah
الله
bi qalb
بقلب
salim.
سليم. أحسنت.
So everything we're talking about here, that you'll see that there's a big balance.
There's
Between
lots of hints in the Quran to talk about the spiritual heart and lots of the stages of the human development when it comes to that. I think.
First of all, I would like to thank our special guest, Dr. Mullah Hajj Karar Al-Kufi, and I know I didn't mention much about his the aspect of his. Next time we can talk about that, about his factor that he does serve Ahlul Bayt consistently. And you would have seen a lot of his latmiyat, and even in the days of farah, and this also too is also on the heart, because the Ahlul Bayt have said when you come to these majalis, they re-alive the hearts. They realize that our kalam, our wording, our narrations is what brings your heart alive again, and it's like it's something that's got rust on it. And all of a sudden, you start polishing that rust off by coming to these places. So I'm hoping that our special guest, our honorable and loving guest, Dr. Mullah Hajj Karar, it's not going to be the first time here, and it's not going to be also the first time, inshallah, we get some positive feedback from you instead of the straightforward lectures, that we can have more of these conversations. We'd like to finish off by the doctor giving us just a final dua, and which will lead us into prayer.
Thank you very much for having me tonight. It's been a pleasure. I think this is a great opportunity for the community to utilize and us as a community members utilize others who are excellent in their professions and who work a lot and work hard in the background and behind the scenes.
So
to
we're
make
going,
life a better
we are
place,
going to
inshallah.
get from a broad range of people from our community, whether they're, like I said, doctors, engineers, plumbers, electricians, carpenters,
Yeah.
everyone that,
Yeah,
that we
you
got
should-
for
if
a
you- if you-
wide
anyone
range,
who's a
anyone that
tradie,
knows, that
please
is
put your
willing to
name
come
down.
on and see how his life as a servant of Ahlul Bayt has similarities with the profession that he does and his religion.
Yeah, inshallah, we ask Allah subhanahu wa ta'ala to give us the tawfiq to continue to serve the Ahlul Bayt. May Allah subhanahu wa ta'ala to bring and hasten the reappearance of the Imam. عجل الله تعالى فرجه الشريف وآخر دعوانا الحمد لله رب العالمين وصلى الله على سيدنا محمد وآله